Everyone, good afternoon. Thank you all for joining us today. So let's talk about it, prostate cancer discussion panel. We want to give it up just for everybody being in the room. Online for streaming this discussion panel, so we're excited for them. So that is the Prostate Cancer Coalition of North Carolina. Thank you all for joining us. Thank you to the vendors who have come out to listen in as well, and just to all of those who are in support of healthy conversations. I won't stand before you long, but my name is Sheena Butler. I'm the health education supervisor, and Healthy Conversations is one of the programs under our division. There's a lot of work to put into the discussion panel. We had one last year, so we're excited to have another session this year for more folks to get informed about the awareness and also to bring that information to your community, to your families, and those that you know that this will support. So we thank you for being here. If you take a second to look at your agenda, and if you don't have an agenda, we'll get you some copies for you. Right after this webinar, we'll have our very own coordinator, Ms. Carlotta, to introduce our speakers today, as well as some of our barbers who are in the room. We'll have a prostate cancer awareness presentation from Dr. Terri Huff-Simmons, and our guest speaker, Mr. Dwight West, who is going to give us some information about his lived experience. We'll have the panel discussion. So we have several of our panelists here to provide us with more information and answer some of those questions that we may have had. And closing remarks will be by Carlotta as well. We'll have some breaks in between. So just for housekeeping reasons, on the if you're looking at the elevators, on the left-hand side is the women's bathrooms right outside this door. On the right-hand side is the men's bathroom. So at any point in time, if you have to step out, please use our back door. Because we are streaming, we just want to make sure that we don't have as much foot traffic right here in the front. So without further ado, I'll hand this over to Carlotta.
All right, good morning, everybody. Sorry, I'm saying good afternoon, everybody. Thank you for sacrificing your Wednesday or your lunch. You could have gotten Tuesday, got back, all of the other things for lunch, but instead you're here with us to talk about something that's very heavy to my heart and near and dear, and especially to the African American community and men all over the world, race, age, prostate cancer, right? And as my lovely supervisor mentioned, this is our second annual. We had our first one last year, and we hope to continue to have to share the awareness. So thank you again for coming. To the right of me, we had some wonderful panelists who sacrificed their time and effort to share some wisdom, some knowledge, and some insight. So we are, of course, going to have some questions for them later in the event. But if you do have some questions, for example, after the presentation by Dr. Huff-Simmons, feel free to ask. But let's try to hold our questions to the end. So we're going to start with Dr. Huff-Simmons. If each one of you will introduce yourself, share your title, what makes you interested in even want to be a panelist, and talk about prostate cancer awareness.
So good afternoon. I am Terri Huff-Simmons. I am an employee of the Cumberland County Health Department, where I primarily work in epidemiology and I am actually sitting in for our medical director, Dr. Hayward. As far as prostate cancer, my husband is a 10+ year survivor of prostate cancer. So hopefully I will be able to answer some of your questions and give you some information that you might not know.
Good afternoon, my name is Russ. I'm retired military, Air Force, not Army. I do not have prostate cancer, don't have prostate cancer, but I take ways to help prevent it or lessen the risk of getting it. And I'm happily retired. Thank Jesus for that. I can say that. And that's about it.
Your dad,
Well, yeah, I'm a dad. I think I'm a good dad. I don't have any grandkids yet. That's the only thing. I want some grandkids. Like, boys, get them right back.
Again, good afternoon. Hopefully, no matter what time of day My name is Victor Taylor, not Dr. Taylor. I'm an advocate of survivor of prostate cancer. I'm an Army strong. So, yes, for prostate cancer, I speak on prostate cancer all over the United States. I'm putting my task myself to put aid support to the state of North Carolina. I've got 30 of them running, so I can talk about prostate cancer. But I'm trying to, I told you I'm trying to provide as much as possible, but please by all means, ask questions. I have several cards. We have a card here that everybody in this room should get. A QR code that tells you about prostate cancer, the importance of screening, the ERE information, the PSA information. It has 2 videos up here to our UNC and Duke. I work with them as well. So I'm in Duke Saturday morning. So again, please get this card. It's like my elevator speech. Sometimes I go to the airport, they're running real fast, and somebody else is running. I share this card with them and tell them that they need to look at it. But please, it's very informative. So again, I'm gonna stop right there. I can talk prostate cancer forever. So again, Vic Saber from North Carolina Coalition in North Carolina. And I'm from Newburgh, North Carolina.
Good afternoon. My name is Tracy Thompson. I am the Air Force veteran. I'm also currently a student at Fayetteville State University. I will be graduating this December. Being a little older, my motivation is my son. He is a sophomore. So to not let him graduate. I'm here as a panelist because I've always had a great concern for the community. And just want to come here to network the word out as I be educated, I educate others.
My name is Dwight West. I am not a veteran. I'm here today because I was diagnosed with stage 4 prostate cancer last October. I'm living it, and I will be here to share my experience as I navigate through this journey.
Thank you. Well, thank you all again for your time and sacrifice. And without further ado, I'm going to call up Dr. You don't have to do this. You did your pen clicker, but he's not going to be your pen. And were you guys able to do them well? Were you guys able to hear them well?
So we have 2 mics.
We do have mics. So Dr. Huff, I'm gonna ask you to grab a microphone. Okay, so we can come straight from here.
Let's talk prostate. Go to the next slide. So the prostate gland is just one part of the male reproductive gland. And that gland is located below the bladder and in front of the rectum. What exactly does the prostate? It is essentially important for fertility. It helps to produce semen, and it has a role in hormone regulation, making testosterone. But essentially, it nourishes sperm, it regulates urine flow, and it contributes to ejaculation. So on the right is a normal prostate. And it is usually about the size of a walnut, it's about 25 grams. But it does increase with age, and with age, it can get enlarged. So you can see the difference in size between the normal and enlarged prostate. So prostate cancer, like every cancer, occurs when the normal cells change into abnormal cells and grow out of control. Commonly, it is estimated that 1.6 million cases of prostate cancer are in the world. 11% of males in the United States will be diagnosed in their lifetime, and the overall 5-year survival rate is over 98%. But early detection is the key in saving lives. African Americans are diagnosed with prostate cancer 1.5 times higher rate than white.
and you are twice as likely to die from prostate cancer. So again, early detection is, and as I said in my introduction, my husband is a 10-year plus cancer survivor, prostate cancer survivor. So I told him I was going to do this talk, and I said, what is one thing you would like the men in the community to know? He essentially said, get tested. That is the one thing that you can do for yourself, is get tested. Symptoms of prostate cancer. Let me tell you, you don't have to have any symptoms at all for prostate cancer. But some of the symptoms, you can have blood in your urine. You can have blood in your semen. You can have urinary problems that just start where you're having a hard time starting the stream, or you start to urinate and then it like sputters and stops, and then you continue. You can have incomplete emptying, feeling as if you have emptied your entire bladder, but then you did, it starts over again. You can have lower back and the lower back pain and bone pain can indicate that cancer has spread to the bones. One of the places where cancer spread, the prostate cancer metastasizes, meaning spreads, is to the bones. Another symptom you can have is you're getting up at night, going to the bathroom frequently, or you're having burning with urination, or even with ejaculation, there's pain. But remember, you don't have to have any symptoms for prostate cancer, which is why you need to get tested. So how do they determine when you need to get tested? As you can see from this slide, the decision making is all over the board. But the one you need to pay attention to is the one that's circled. And this is the screening for people of high risk. African American males are high risk for prostate cancer. So if you are at high risk, you need to get screening starting at the age of 40. High risk for prostate cancer, African American, older males, if you have a family history. So if your father had prostate cancer, you need to get screened at the age of 40. Don't let them tell you 50. You need to get screened at the age of 40. Early detection is the key. Be an advocate for yourself. If your BMI is greater than 30, you need to get screened for prostate cancer at the age of 40. If you eat a diet high in fat and processed foods, that might put you at a higher risk. So if you are at high risk, and I'm talking to the Black males in here and possibly watching on video, if you are at high risk, what age are you going to get screened at?
40.
Thank you. You got screened at age 37?
No, I got, that's colonoscopy, right? But no? Okay, we all should go get that done. I'm worried.
So how do you get screened for prostate cancer? So there are two tests. Most men might have been familiar with the digital rectal exam. That's the turn your head and palm that most men don't like to do because it's exactly what it says, digital rectal exam. You don't have to have that done. Actually, that test right there can contribute to an increase in your PSA. Just throw your arm out, let them stick a needle in it and take some blood and get the PSA test done, the prostate specific antigen. And that is just as easy as 1, 2, 3. So get that screening at the age of 40. It is a protein that they're going to be looking for that is made and released, made by the prostate and released in the blood. Okay. So they recommend that you get screening every 2 years. I personally recommend you get screening every year because false positives can occur. The more you know, the better you are. What can cause the prostate to be elevated? What can cause that PSA to be elevated? If your prostate is enlarged, that can cause the PSA to be elevated. And just because your prostate is enlarged does not necessarily mean you have prostate cancer. Again, remember I said that the prostate can become enlarged with age. It's just a natural occurrence, okay? Prostatitis. Prostatitis is the inflammation of the prostate. If that prostate is inflamed, that can cause your PSA levels to be higher. Usually what they will do if your PSA level is elevated and you think you have prostatitis, they will put you on an antibiotic to decrease the inflammation because it might be due to a viral or a bacterial infection. So they will put you on an antibiotic for 7 to 10 days to see if those levels go down. And if it goes down, they might say, okay, then it was due to the inflammation in the prostate. Prostate cancer itself can cause the PSA levels to be elevated. Recent ejaculation can cause it. Riding a bike can cause it. And then the digital rectal exam trauma. I saw your eyes back. So if you're riding that bike and you're right, think about where you're positioned on a bike when you ride a bike and where that prostate is. So if you're riding that bike and that gland gets traumatized in a way, and that can increase the PSA too. So how is prostate cancer treated? How is it treated? There are many treatments for prostate cancer. One is observation. So one is observation. And I tell this story because about the observation, I laugh because my husband and I had just came back from having his surgery. He had his prostate removed by robotic surgery at the Ohio State University. And after we got back from Ohio State, we were sitting on the couch in our home and watching the news. And they had came out and said that surgery is no longer first line. They don't recommend surgery anymore first line for men who have had prostate cancer because it can be such a slow growing cancer that they recommend observation. And of course, we turned to each other and we were just like, wow, like now you tell us. But observation is one of the ways that you can treat prostate cancer because it's so slow growing. Surgery where they will remove the prostate is another way. Radiation therapy. There's hormone therapy. The hormone therapy, the main focus of that is it wants to decrease the levels of male hormones such as testosterone that fuels the prostate cancer cells to grow. So that's what hormone therapy does. There's chemotherapy. I think we've all heard of chemotherapy. And there's immunotherapy. And immunotherapy is a type of cancer treatment that helps the immune system fight and attack cancer cells. So those are all the ways that you can treat prostate cancer. So risk reduction. What can you do to prevent your risk of prostate cancer? Well, we're always going to tell you a healthy diet. So you want to eat plenty of fruits and vegetables and whole grains. Limit your intake of red meats, especially high fat or processed meats like deli meats, hot dogs, and bacon. Get to and stay at a healthy weight. Remember, I said one of the risk factors for prostate cancer can be obesity. So if your BMI is greater than 30, you need to work on bringing that BMI down out of the obese range. Get physically active. Walking does a body good. Even if you don't go to the gym every day, if you walk for 30 minutes a day, walking does a body good. So physical activity is really good in helping to reduce your prostate cancer risk reduction. Vitamin D. We all need vitamin D. African Americans we have some of the lowest vitamin D levels out there. So get out in the sun, enjoy some vitamin D, use sunscreen, but get out there and enjoy some vitamin D. Or if need be, have your medical provider draw your vitamin D levels to see where your levels are. Yes. Avoid smoking and limit alcohol, and stay current on your annual exams. If you are in this room or on video and you are a African-American male and you have not gone to your primary care provider to get a physical this year, you need to expeditiously pick up the telephone, call, and schedule your annual physical. Annual physicals, the purpose of them are for prevention. Last but not least, prostate cancer prevention. I mentioned some of these. Choose a low-fat diet. Eat more fat from plants than from animals. Not trying to take you to go all the way vegan, but just try to eat more stuff from plants. You exhaling so fast like that. Increase the amount of fruits and vegetables that you eat. Eat fish. Salmon, tuna, herring. You want those omega-3 fatty acids. Reduce the amount of dairy products you eat every day. I would say any questions, but she said we're gonna have questions.
Okay.
This is something you talked about, some of the effects that make the prostate get enlarged or affected. Can a man, too much ejaculation from his ass, can that be a factor of increasing the prostate to go into that stage?
So you're saying can too much ejaculation increase?
Masturbating, can that
So ejaculation can cause increase in the PSA.
and what about like some people are very sexually active too as well, which is the same thing. So can that be a factor of having to control that a little bit better than to have too much of it? That can cause you to do that.
So what I would say is if you know you're getting ready to go to the doctor, you're gonna have a PSA drawn. I would say curb the sexual activity so you might not get a false positive result.
Right, next question I have is how long does it take for a person after they have the surgery or the robotic surgery to recover at least 90% of the functionality of the prostate? Because my dad was diagnosed and he had a robotic surgery. How long does that take for that prostate? Because that's a concern of men. I have clients asking in the shop because they are a little concerned, but all of that.
That's gonna depend on each individual. And so my husband had his surgery. He ended up having a vasectomy because of the prostate surgery, because of the proximity to the vas deferens and the sexual organ that carried the sperm, because of where the prostate was. They snipped. So truthfully, if I'm gonna be, and he knows this, truthfully, if I'm gonna say this, I was like, hallelujah, yay. Because I have been trying to get him to get a vasectomy. So I was like, cool. And you are absolutely right. The functioning that you're talking about is how long after surgery is a man able to have an erection, a full erection, and that is going to vary from man to man.
Okay. Next, last question is I know you talked about the hormone therapy, that hormone therapy to reduce the testosterone in the male, right? Doesn't that when you reduce testosterone, it's also going to increase hair loss? Because we work in an industry where the hair loss is a big factor for clients, just like prostate, because the hair loss it's an organ, and also the person feels very depressed when they lose their hair. So doesn't that when you reduce the testosterone levels, that increases the possibility of more hair loss?
So if we decrease testosterone, will there be more hair loss for men? This is a possibility.
Okay.
Which is why you have other options. So I can't say that if you do this, it's going to affect you this way, and if somebody else does the same thing, it's going to affect them the same way. It is still going to be based on individual, based on each individual. But to have that information and for you to take that information is vital. So you can take it and sit down with your primary care provider, your oncologist, or whoever you're seeing, so that you can advocate for yourself and say, this is what I'm concerned about if I do this type of therapy.
Okay, thank you, Dr. Terri.
Oh, my name is Anthony Ross, retired Air Force. Okay. I want to hear this from a different perspective. A lot of ex-athletes, as they get older, especially African male or Black men, once we hit a certain age, 40 and up, our testosterone naturally goes down, our hormones actually go down. Now, I'm speaking from experience because for the past 15 years, I've been on hormone replacement. I have to actually give myself testosterone injections, 100 milligrams once a week. And that raised my my testosterone level back up to normal. It's actually exceed normal. And it does help that I eat healthy, drink a lot of water, and I stay in the gym. But with that said, it can enlarge your prostate. So I have my prostate checked minimum every 6 months. So if you're getting or if you're in the gym where you're working out and you're not under a doctor's care and you take hormone replacements, TRT, or any type of a steroid, you need to have the prostate monitored because that can cause a prostate to actually grow. Another thing that people fail to take into account is drinking a lot of water. Water is key. I drink a gallon of water a day, and I am peeing like every 5 minutes. Every 5 minutes. But the thing is, if you're on medication, it helps flush all that a lot of medication your body's not using because it has to go through your liver to function. When you drink water, it's getting those toxins out as well. So, and as far as the hair is concerned, for me personally, this is my own personal belief. I'd rather be healthy and bald headed, have a head full of hair, and take a chance to catch a prostate. Now, there's good to having a certain amount of arrogance, but if you're that arrogant over your hair, why don't you be that arrogant over your waistline? Why don't you be that arrogant over, how you actually act toward and treat people? Well, there's other ways to mitigate, as far as hair loss. Like that's my personal thing. I had a hair full of beautiful curly hair, my barber George can tell you. It started thin, I said, dog, take it off, man. It's time to let it go. Because they let me go. It's good while it lasts. But your hair doesn't define you. Your clothes don't define you. Your job don't define you. You define you. And get back to the testosterone, low levels. And in fact, my urologist, she graduated from Hampton with a sister. And I was kind of like, that sister, she checked my testicles and she all up in me and stuff. I'm like, damn, look, it's uncomfortable. But she broke it down to me. She was like, look, it's best you do this and live as you will be 85, 90 years old and healthy, or 65 or 70 and dead. That put in perspective for me, So, like I said, get this done because the survival rate is like 95 to 90%. Not 99.5. I can't read right, but I can count. 98.5. That's pretty darn good. So get over the stigmatism of I don't want to bend over this and that. Every time I go in there, like Dr. Tom Kenny, like me, I was like, all right. One time I got to the point where like, lean up. I'm like, hey, please offer me a cigarette or something, man. That's how you gotta look at it. Because it's your health. If they catch it early, then you're gonna survive.
And I will say that when my husband was diagnosed with prostate cancer, I will never forget where I sat in that office. I will never forget hearing those words. But I will also never forget for him that my first thought went to, and not trying to lessen anybody else's experience, but being 100% truthful with you, my first thought went to, thank God it's prostate cancer. Because I knew prostate cancer was a slow growing cancer.
said I wasn't talking too much, but again, that's it here. Because they talked about a couple of things. They're going to look at this. All right. Everybody again? And survive. Early detection saved lives. Dr. Simmons talked. Some things I agree, some things I don't agree, because I speak to a lot of urologists, pathologists all around the United States. Every year you should be tested. Every year. American Cancer Center Society is putting out some information every 2 years. At age 50. No, you need to be the age of 40. There's 3 risk factors. Age of 40, African American, family history. Okay. If your sister had breast cancer, check it out. You can check prostate cancer. All right. But somehow they are related. All right. So that goes to the family history. 99 men in the family should be getting from prostate cancer. Because I had no history of cancer in my family at all. At the age of 42, I was diagnosed with prostate. Again, PSA, PRE. I'm an advocate for PRE. The reason why, because my PSA was 0. 0. When they did the DRE, that's when he found the abnormality on my prostate. That's when I had the biopsy, the MRI, and found out 85% of my prostate was cancer. So I stand for the DRE. Once you get your DRE, should be every year. Should do both of them. I got it saying that you can have the PSA and the DRE, the light blue blood. Uncomfortable for a moment, work for lifetime. Sure. Uncomfortable for a moment, and I'm straightforward. No kids in the room, ladies, you all adults. Okay. Men come to me all the time. I get stopped at funerals, that stop like everywhere. I don't want to do that because it's gonna make me gay. If it's gonna make you gay, you're already gay.
Oh, Lord.
I'm telling the truth. I talk to them. I'm legit. Okay. I have some guys say, look, ask the doctor to take you out to dinner if you do it. Fine. But get it done. Uncomfortable for a moment, work a lifetime. I would not possibly not be here if I hadn't had that DRE. There's people out here talking that DRE is not necessary. It is necessary. 69% is diagnosed with the PSA. The other 31% diagnosed with the DRE. 69 is by the PSA. 31 is diagnosed with the DRE. That makes the 100. Biopsy is only if there's some kind of substance issue. The biopsy is the second part. To verify if it's cancer. They're just going, they're going here right here. This is what they try to feel something soft. They feel something here, that's an abnormal. That's when it was done. That's when the biopsy is involved, MRI is involved. There's a lot of stuff that's out here. Like I said, I go to a lot of conferences throughout the United States. They got it also called proton therapy. Hampton, Virginia. Non-invasive, don't have to have surgery. My brother was diagnosed after I was diagnosed. He went to Hampton Roads, 28 treatments of radiation, cancer-free. Cancer is not always free. Everybody say cancer-free, but there's a chance of the cancer coming back. So I'm coming up with a different word. You're living with cancer. I've only had one biopsy and it's laughing cold. Once they do that, they put it on the microphone and they tell you whether it's cancer. Then you go from there. Don't let anybody pull your prostate cancer out prior to doing that. Okay? So some doctors will do that. It's all about this something. And sorry to say they do it in our neighborhood most. All right. So again, I could talk forever. I'm gonna let you stop. Any questions?
All right, take that. In here.
Thanks again. My name is Dwight West. I am honored to be sitting here in front of you today to share my story. First, I just want to apologize up front because part of my side effects with chemo and the hormone therapy and all of these things that I have to endure causes me to have fogginess in my mind. So there's a lot of things that I want to say, but my brain and my mouth are not connecting. So in order for me to articulate myself, I have to slow down, kind of think about what I'm about to say, for it all to jive. So I just wanted to apologize up front if if I seem a little slow. I can tell you that that's been tough for me because I feel like I've lost a part of myself, and I can be honest with you about that. But that's part of my new normal. My oncologist would like to say, he calls it menopause. Right? He wanted to make fun. You know, he wanted to lighten up what I'm about to go through. So I understand what that meant. But now that I'm almost a year into this treatment, I understand fully what he was talking about. And so my journey started back in 2022. Because once I pulled my medical records, I was able to go back and track some stuff. And back in 2022, my PSA level was already at 23. However, life was life. I didn't feel different. I didn't see anything on the outside that was different. So I didn't take it seriously. That's my story. That's the truth. The appointment was scheduled with the urologist. I didn't go to the appointment because, in hindsight, it's not my doctor's fault because I fired her anyway. There was no sense of urgency. Now, that can be misconstrued on my part of saying that, hey, she didn't bring to light what I had going on back then. But I will own it and say that I just allowed life to life and I was not responsible and take care of my business. Okay. So I own that. So we moved to 2024 and my doctor orders a blood test. The numbers come back at 68 now. Send me to the urologist. Does the test, doesn't feel anything. I'm feeling pretty good. Now we have to go to Dr. Owusu to do a biopsy. I'm still feeling pretty good because again, I'm not feeling any different. So once the biopsy happens and my chart is now available, I did my own investigating. Words I didn't understand, I Googled them. Before I went and sat down with him, I already knew that I was in stage 4 in the cancer spread. So I already had that information before I went and sat down with him. So now we have to have a totally different conversation. And before he could get into what he got into, I told him what I had already did, what I knew. So now my next question to him was, am I gonna die? His response to me was, no, you're not gonna die, but you have to fight. You have to fight, you know? And I was like, okay, well, I've been fighting my entire life, so that's all I have to do, then let's do this, let's get ready. And now I go to oncology, I have to go to radiation every day for 3 months. And during the radiation time, I'm doing the hormone therapy, I'm doing chemo, I'm doing all of this stuff. And again, I still feel regular, you know what I mean? Like, because in my mind, it's not registering to me that, hey, listen, you're just starting this process. So ego is like, oh man, you know what I mean? Like I'm feeling pretty good. Radiation is done, I ring the bell, get a false sense of security. And then the side effects start to reveal themselves. Now here come the hot flash. I am so empathetic to the ladies. My whole thought process of whatever you guys have to go through, I'm telling you right now, I feel you because I'm living it. And so, dude, those hot come when they want to come. I've had a few of them since I've been sitting here. I will tell you that I love my barber George because I've been open and honest with him, the guys, and they talk about what I'm going through. And whenever he's cutting my hair, he sees. Now we've gotten so close now where he can actually tell when I'm having a hot. And so he'll cut the fan on. And to me, that's a beautiful thing because but that's a beautiful thing because he's mindful of it. And to me, that's a next level of respect amongst men because a lot of times we don't want to show our affection towards each other or that can be looked at as being soft, but I'm blessed to have this man and these guys in the shop that have held me up in times when I come in there and I'm just, and I'm tight, so this new normal and everything that prostate cancer brings with it, physically, emotionally, and mentally, it's been a struggle. But I've had to embrace it and accept the side effects because when I go to the cancer center and I sit around these people, I was told earlier on in this process to make sure that I have a positive atmosphere. That I had people around me who would build me up, and I really didn't understand what that meant. But now I understand that, at least for me, the physical stuff, my ego took a serious hit when it comes to that. Because they talked about wearing diapers. Crazy. I'm not doing that. Well, I'm sitting here right now with one on. And I had to do that because of the embarrassment of not having one on when I'm out at a restaurant and I can't get to the bathroom because the prostate is not holding anything. So now I'm urinating. So ego hit because I refuse to believe that once, first of all, that I got cancer, and secondly, that it's messing with my manhood. It's one thing to navigate through this thing, but I'm a man. That's got, at least let me hold on to that. And I struggle with that. I struggle with the ED, the fact that that's not working. And at one point in time of my life, I represented myself that way, but now that's all been taken away. So again, it's like from the mental and emotional part, I would say that's been the toughest part for me to endure because I wasn't prepared for that. And I understand it physically, but my definition of what a man is was now in question. Because now I had to start looking at things from a totally different perspective. It's not all about the bravado, it's about me living. So now, bro, exercise some humility. And if you have to wear a diaper, do what you have to do because this is not something that you have to deal with for the rest of your life. But in this moment, the next year and a half, this is your reality. This is your new normal. So embrace it. And once I started to do that, then things for me personally started to get a little bit better. And now when you introduce the family to what you have going on, that's an entirely different dynamic. Because as soon as they hear cancer, not everyone wants to prepare for a referral. Well, they want to treat you different. Now, one thing I can tell you is that there were a lot of areas in my life that were broken and a lot of things that were misunderstood. But once I got this diagnosis, all that stuff that we had going on, it didn't seem to matter anymore. So now all the things that we were bickering and beeping about, all this little petty stuff, all that stuff went out the window. So I see that now as a blessing. Because had not I had this diagnosis or whatever I'm going through right now, who knows what that would have looked like. You know what I mean? So I've tried to find the silver lining in this thing. Because every single day I wake up is a different day. I don't have any testosterone because of the blockers. So I don't know what to feel. And I talk to my doctor all the time, and I'm calling him like, hey man, I don't know what's going on here. And he's like, listen, this is part of the process. The side effects are, this is part of what you're going through with this cancer. But he said something to me the other day that really touched me. And he said to me, listen, you're worrying about all the wrong things. You're worried about all this outside stuff. You're worried about superficial stuff. But what I'm telling you right now is when you started this back in October, your PSA level went from 63 to 78. You went to radiation. And after the 3 months of radiation, your PSA level is at 0. And my PSA level has been at 0 since June. So now I have another dilemma in my own mind. Oh, I've been at 0 since June. I can stop now. I don't have to take these meds no more. I'm good. I'm good. No, you're not good. Because that's one of the tricks that they spoke to me about that a lot of men have when those PS levels start to be consistent and you think that you're cured and now you don't want to take the meds, what you want to stop the treatment. Well, if it comes back aggressively, now we have to have a different conversation. So I've been taking everything in stride. I really had to check my ego at the door to be able to get through this process. From the physical standpoint, yeah, there's some physical stuff, but I didn't understand the mental grind that comes along with going through this process. I didn't understand it. I know that it's different for every person, but for a guy who was a man's man, you know, it just feeling like part of me and taken away. That was really, really tough. That was hard. That was a hard pill to swallow. But I sit here in front of you guys, humble, honored to be able to share, you know, what I've gone through. Is in my case, I just failed to take this stuff serious. There was an opportunity for me to have the surgery. There was an opportunity for me to not go through what I'm going through. But I dropped the ball kind of on that. But now that I'm sitting here and I'm going through this process, I feel like I'll be used to educate other men on a lot of different, you know what I mean? Definitely take your health serious. We are not Superman. You don't have to wait until you're on your deathbed, or you don't have to wait until, you know, something is truly visible for you to go get checked. And then when you sit in those offices and you hear the numbers, I was triggered. She was going through the slide because I felt like I was being diagnosed all over again. And you hear the numbers of how prolific it is with men of color, and you're like, wow. But the one thing, and I'll end here, is that the one thing that I am so grateful for is that I have a solid support of men in my life that when things start to get a little tight, they use cap. And they love, support. They allow me to share with them what I'm going through. To be able to walk into the barbershop and you walk in and everybody, hey, yo, what's good, Miami? How you doing, man? And the first thing they do is, you good? Let me give you a hug, bro. You good? You good? You good? Yeah, I'm like, that's awesome. You know, that's awesome. And that's how I met this young lady. So I was sitting in this chair and then we put this together. So I'm honored to be able to sit here with you guys and share. And, you know, as I continue to go through the process, I have a little ways to go, but as the young lady to my left and I spoke about earlier, I had to speak that plan because I believe that, right? And so everything else was going through the fire to get to the other side. So I want to thank you for the support. Thank you for having the opportunity to come and sit here, share my story. For you men out there, and for the men on the Zoom, go get checked. Thank you.
Thank you, Mr. West. Anyone have any questions or comments for Mr. West before we move on?
I have a comment. I just really, appreciate that you said, that your barber can tell if you have hot flashes and turn on the fan, and how when we have someone in our lives who is, going through something like this, the littlest thing means so much to us. So those of us who want to support the people in our lives who are struggling, who are going through cancer, we don't have to do big things to make it. It's the little things that we can do that unify. So thank you so much.
For the people in the room, shout out to Barbara real quick.
Yeah, my barber is George Hollingsworth, the best barber in the world.
That's right. That's right. That's right.
Barbara with the under a program called Healthy Conversation. You have hands out in front of you, palm card as well, that shares a little bit of information about Healthy Conversation. Before we go into our panel discussion. Healthy Conversation is a community-focused program designed to promote health awareness and education on topics to include heart health, prostate cancer, and colorectal cancer. The program is in partnership with local trained barbers and stylists who advocate for health and wellness in their community. On the back of that paper, you will find some frequently asked questions and some not some, but all should be all here. Okay, the names of our contracted barbers and stylists and the name of their business. And if you have any questions for them, they'll be here today. Most of them are in the room. And if you have some further questions, at the bottom of the handout, there's a QR code and my contact number. You're welcome to reach out. All right, so now we have that out of the way. And Mr. George is proving that this evidence-based program is working.
George.
And all of our other work stylists in the room, thank you. Yeah. Okay, we are going to go into our panel, guys. So those of you on Zoom, if you can begin sharing your questions in the chat, and we'll make sure to check in. We had one comment up there from Mr. James. He wanted to generate verbiage about observation and active surveillance. That is a term that we are utilizing now in the world instead of observation. All right, so how this kind of works is if you have any questions in the audience, we're on the Zoom. So with that, I took out some pre-arranged questions for everyone. Are there any questions in the audience? I think we had an array of conversations and topics that were covered. Manhood, menopause, that was a new term. I'm going to use because I've heard of having your own personal summer for menopause, and I think that's catchy. So we come in.
Yes, yes.
You know, we have some persons who are representatives of the military as well. We have, of course, a provider with us. So, any questions? These are dads, you know, they're active in their community, their husbands, wives. We have another member of here who is also a part of this Healthy Conversation program. So if you have any questions for her or any other part of the staff in the room, if you have any questions for them, feel free. So who would like to go first? I'll go first. Okay. I'll be there.
My question is for you, Dwight West. When you got diagnosed, it's because it's sort of like when you get diagnosed, the whole family gets diagnosed. How was it for you telling your family, telling the children, and just dealing with the questions and whatever else you have?
I didn't want to tell them. I didn't want to tell my family, my children, anything at all. I wanted to ride this wave solo. I, felt like throughout my life, like I've done some, and that's a whole different story. I didn't want to add anything onto some of the stuff that, I had already paused, things of that nature, right? But I felt like they needed to know, and not for any gloom and doom reasons, but just for support. But I didn't tell everybody in the family, right? I had to pick and choose who I was going to share that information with, because I didn't want everybody to become a doctor and try to diagnose me. And, I heard sob stuff and all of these other things. Trust me, man, when I opened that door, everybody became a holistic doctor. And so I had to shut that door very quickly, because I was becoming, I had a lot of anxiety, listening to, people come from this way and then the doctors come from this way. And I had to really take a step back and say, all right, no, but need to kind of do this in office. Because the one thing that I disliked, that question about, are you okay? Or how do you? Because I couldn't answer. Because physically, I was all right. Mentally, I wasn't going through anything at the time. So to be bombarded with those questions, it was more hurtful than helpful. But yeah, I didn't want to share that information with anyone, probably for the reason that I have just explained to you. But I did offer at least my children and my closest family members the opportunity to pray for me, support me, because I have a praying family with believers, right? So I had to utilize that and have them, bring that to the forefront so that we could tackle this thing together.
And so this is for anybody in the campus. And I was a little bit delayed today, so we may have already addressed this. I actually have two questions.
I have two questions, if that's okay. So one is in regards to prostate cancer and the changes in hair. So did you end up losing all of your hair or some of your hair?
I did not, thankfully. Yes, I did not lose any hair at all. I go to the barber quite frequently, and I'm getting touched up. And so for me, I do chemo daily. I'm on the hormone therapy, but I want to say it's probably different for everybody. But that just hasn't been my story. At least not that side. I have others, but not.
So then the other question that I have is in regards to prostatitis and prostate cancer. Is there a correlation or because two men during the healthy conversation, two men in my timeline they ended up getting into a heated conversation. And so one had elevated prostate and had started going through some type of treatments or something. And the other one had prostatitis. And so I was amazed at how far the conversation took off. And I just offered them a seat in the classroom so that they can go and talk. Because it just was really like engrossed in the conversation. I couldn't indulge because I didn't know 100% how to. And so I feel like this is the place that I can come to get information in regards to prostatitis and prostate cancer.
So are you, make sure I understand what you're saying. You want to know the difference between prostate cancer and prostatitis. So, even I have trouble saying something. Prostatitis is the inflammation of the prostate. It does not always lead to prostate cancer. They can be two separate things. Prostatitis can be caused by a viral infection or a bacterial infection. That answer. Well, does it increase the PSA? So it will increase the PSA level. So I don't know if how my husband's cancer was, I want to say it was first found because he had a biopsy, but he went religiously every year to have a physical and they would draw PSA. And it was slowly increasing. So they did the digital rectal exam, didn't find anything there. And they decided that he had prostatitis. So they put him on an antibiotic for 7 to 10 days. That level came down. Went back the following year, the same thing kept happening. And they decided to do a biopsy one of those times. And they didn't find anything. So they were like, okay, no cancer. Go back the next year, same thing, prostatitis, put them on an antibiotic. The levels didn't come down to how they had responded before. They had to do another biopsy. They had to go further up on the prostate. And that's where they found that his prostate cancer, when it was all over, said the PSA was 6 and his prostate, the cancer was in 6% of his prostate, and his Gleason score, which is how they score it, was 6. So, but he went through that prostatitis. Let's make sure it's not this. Let's put you on the antibiotics. Everything came down, but it does not necessarily lead to prostate cancer.
But the fact that it keeps coming back doesn't indicate that
Something was wrong, and that's why they did his biopsy, because the levels kept going up. So to me,
Is it because the protein, it's protein levels, or has to do with the protein levels keep causing that that passageway to be either damaged or be inflamed? Is that what that is?
Yeah. And see, I didn't say anything initially, I'm not a doctor. Okay? I just want to put that out there. So I share with information for that I've gone through, guys that I've gone through. So I can't share information from a doctor's point of view, because you can say Victor Paper said it, and I don't want to feed the wrong information. That's why I kept looking at doctors. Okay? Let the doctor, that's what they get paid for, and that's what they're educated to do. I do have some answers, but if there's a doctor in the room, like there's a preacher in the room, the preacher's gonna preach, they're gonna pray. But if doctor's in the room, I'll let the doctor do her job, his job. I agree with what she's saying.
But we don't know everything.
You're right, but I don't want to say anything when it's a doctor.
I like lived experiences.
Yeah. But the doctor was on point. Doctor was on point, exactly what she said. That's the difference of the two.
So they didn't find the cancer the second biopsy.
So for my husband, they did not find the cancer until the second biopsy because they had to go further up.
So
On.
the cancer was was given, the leakage that really led to that reading, to have that reading. To be causing this higher up, and they get them joint from below. To get to it, I mean, they had to get to that problem, pretty much had to, something had to trigger that, to see that, to keep that, to have that.
So-
Process.
If
Keep coming back.
knowing me, and if I'm remembering correctly, I was tired of going through the back and forth. So I was basically like, you need to do something else. If you need, what other option do we have? Because we need to figure out what the issue is. And they said we could do another one and go higher up. So I wasn't letting it go because something was causing this, and I wasn't satisfied with antibiotics going down, then going back up, and nothing in his lifestyle changed. So I needed him.
So basically, she saved her husband's life. 'Cause if like you wouldn't have pressed the issue, then your husband probably would have never knew, and the doctors probably would have like just left it as that.
I don't necessarily feel like I saved his life because he is on his health. My husband gets more physicals and sees his doctor more than I do. So I feel like maybe that year, if I would not have pressed it, then the following year when he went in for his physical, they would have drew again. And yeah, maybe it would have been higher. I don't know. But all I know is I wasn't satisfied and something needed to be done. And I'm that type of person to where I need answers to the point to where I totally understand, even though I'm in the medical field. I need you to explain it to me where 1 + 1 = 2. And this is why this is happening, or I'm not good. And it's not good if I'm not good.
Agree with my brother. Good life savings. And I say that because one of our survey questions is about being an advocate. Being an advocate. So that brings to my mind, like, why that question is in the survey. Because sometimes we as women, we understand and we know things, but if we don't say anything, then they think that it's okay. And therefore, but I'm thinking like reoccurrence to me means that something is not happening. You need to step into it and, investigate further. So, yeah.
So I am a big proponent of people being an advocate for people with us.
I want to piggyback off that because if you know something's not right with you, go back. Go back as much as they say, like, well, I don't want to nag them. I don't want to bother them. Yes, you do. It's you. Keep going back. Keep going back. If you know your toe or your ankle keeps swelling up, and it says, but your ankles keep swelling up, there's something causing the ankle to swell. Go back. A closed mouth don't get fed. Go back. Do your best advocate. That's not the time to be shy or insecure. You only got one you. You have to go back to yourself and check and check and check. No, something right now gotta tell me something. If you can't give somebody who can't.
Yeah,
That protein level when that protein level increase like that, sometimes that the human body stresses a lot too. And that stress sometimes causes that because people man burn the urine. And that burning urine is a signal. It feels like it comes like you could possibly have an STD, feel like you have something. That's an increase in the protein. And because sometimes they're not eating a lot of green vegetables that actually kind of like curb it. And because I had it a long time ago, I had an experience with that years ago. And I was scared, but the doctor said, you are stressing. And the stress levels are going up because it's showing on the reading on the chart. I didn't want to believe it because the experience I was having was, we all know as men, if you have a urine that is burning or something's happening, something ain't right. And if you sexually active or you that place, you got 2 challenges going on in your head. And it's 10 different ways to make you even more stressed out. So my thing is that if you feel like that protein level is increasing, and like how you said that you found it and going higher, you pretty much saved it.
Well, think back on if you're not satisfied, the doctors work for us. We don't work for the doctor. Okay. If you're not married, that's what they got. If you're not satisfied, you can doctor. If you're not satisfied with doctor, go find another doctor. Okay, go find another doctor. And also, I'm on Capitol Hill every year in February, advocating for prostate funding. At the same time, there's an annual urology conference up there in DC at the same time. So most of the urologists throughout the United States should be there because they put out a lot of new information that's available, that's coming through the pipes now. That a lot of urologists are upset with the local people that's all I need to worry about. I don't need to worry about what's coming down the pipe. I'm just gonna take care of Bob and Bill and Sue. And I can care less what's coming down the pipe. So if they don't go to the new meetings and hear that new stuff coming down the pipe, they never know that new stuff is down the pipe. So what I do, by the time it gets down, it's about 10 years later. Okay. What I do, I slide across the hallway and they let me in and I get the information I share with the doctor. Well, and all they do is hit a button, there it is. Okay. So if they don't do it, they just talk them like it is. I'm from New York. The biggest city in the state of North Carolina. They know what I'm talking about. I'm always talking about Craven County, New York. But we were so busy we gave up the cap. But that's the story. I bring it back so they know, push that button, there it is. There's new stuff that's out. Proton therapy. A lot of people doctors don't know about proton therapy. Okay? But that's a major research that came out of the pipe. But again, don't like the doctor, I don't know. They don't like it over there.
That's true. Okay, well, I have a few questions for especially our military. We all know that North Carolina is known for the military.
Airborne.
Right. And just some of the data that we've seen, especially as we looked at creating this program, a military man, whatever branch it is, and definitely being an African American man who is also military, said that are at a 3 times higher chance of being diagnosed with prostate cancer and passing away from it. And so when I look at data like that, it makes my wheels turn in my brain. So what are we not doing in our military services? And I'm not talking about it. Thank you to everyone who has served and sacrificed. But what are we not doing to make sure that not just our Black men, but definitely all military men are taking prevention, have the awareness and the resources that they need to lessen that statistic? What, from a military perspective, what did you see from your own eyes that either kept you as a barrier to getting the knowledge and the resources, or was it just not having screenings? But what can you enlighten us? Someone military.
Two of us goes first. Because I know. Why don't you go first? I am on.
How like that?
That might be on first.
Lead the way.
But we were here first. In the military, there was no such thing as prostate screening. I never heard of prostate screening throughout my whole military experience. I never got a screening. I never went to a clinic and the doctor said we're going to screen for prostate. I'm a veteran now. I go to VA, Greenville, Durham, Mohead, and they still don't fit in prostate. That's it, and I'm telling them here, I have circulars where it's talk. We need to get the VA to start talking. We need to get the VA to start talking and taking care of their airmen, their soldiers, their Marines, their sailors, because we need to take care. And we have to ask for it, and that's a shame. We have to go in there and say, I need to screen it.
Yeah.
They start now?
That's it.
Where you at now?
There's something, man.
Whether if you want to, one that was on ramp here.
The new one on Rayford Road.
Yeah. I already done that, but I'm asking about.
Oh, yeah, make sure you tell the light new bill.
Yeah, I.
Alright, but yeah, that, Air Force is gonna have a drive part.
Thank you, that's very gracious of you. This is really back and forth because if you scored higher on the test, you got an error. That's a fact, you know what I'm saying? So anyway, like I was there. But I can only speak from a black perspective, black male perspective. We all know as a black male, we have to do, or as a black people, we have to do 3 or 4 times more to be considered, and even then, we're still not considered. So fear of lack of promotion, fear of lack of advancement, fear of lack of getting other jobs in the military, especially on the Air Force side. I can speak that I know it's supposed to be 12 days. It's 12 days didn't count because I did it. That's why I said 12 days. So we there's a lot of times I would go in and I'd be like, I can't talk about this. I can't tell if this is happening because that removed me from being put in a slot where I can get promoted, you know, or I can be considered. Because if I say something, I'm being combative. If my white counterpart says something, they're being a go-getter. Atta boy, they're showing initiative. See, so a lot of times we're like, I got to throw it back. I got to throw it back. You got to choose your battles very carefully. That's another reason. There are a lot of stressors in the military period, especially if you are a black male in the military. I'm not negating black females because I'm not a female. I'm black males in the military. And there's a lot we have to go through. You know, I mean, emotionally, psychologically, and physically. You know, so all that causes health issues.
Just trying to get the microphone on. Okay. Ms. Thompson, would you like to add anything from your perspective from the military, anything that you observed, even about the scriptures, because it sounds like they do very minimum. Now talking about military, very minimum.
All prostate screen. I do know that now that I'm hearing that it's not all now that I'm in the know of, that I do plan to advocate and speak to someone. Council that we should help.
I want to come to Mr. Anthony Rose. Mr. Anthony Rose, you said something there that you said about lack of motion because of color of our skin and possibly losing our job placement because of motion. I don't think that's necessarily true. I think truthfully with education because I see educated brothers went forward. I see educated people went forward because if you need me for education for what you need to make it forward, you need me. I just think that we were scared to really get educated on no. That's my opinion on it. I'm not saying that what you said is not totally true, but it's still was a factor between it that we had that education. Because as we get educated ourselves now, we are more aware of what's going on to be more mindful of whether it's for prostate. So I think we just didn't have access to information at that time.
Now, not to negate what you said, but you said it's from your experience, like it's from my experience, okay? If you say it's true, what I say is true. Two things can be true at the same time. But when you speak on the education factor, I have my education. Before I got out of the military, I already had my bachelor's degree and was working on my first master's degree. And still wasn't, I was overlooked on a lot of times. I had commanders like, well, if you get your education, then they come to work and look, it's like, you actually working on a graduate degree? Yes, I am. But they never consider. That's my experience, my personal experience.
You were listed all.
I was enlisted. And proud of.
We have a question back here.
I was just gonna add to the military aspect of it, because I was Army, but I was Army aviation, so I was somewhere in the middle. I worked on helicopters. Chill on the airfield. But to my point is, even as a young soldier, we were taught in the military that you only go sick call when something truly is wrong. Okay? So, and just like we went through AIT, a medic ain't nothing but a cook that know the difference between a spoon and a syringe.
Come on.
You know what I'm saying? They're not medic trained like that. So they only know put a Band-Aid on it and get you back to work. Like I worked on radar equipment, countermeasures, putting out all kind of radiation. All we had was a plexiglass protecting us because that's what we were taught. You don't think that stuff caused some kind of cancer? It did. And I'm learning now at the age of 40. Oh yeah, maybe they should prepare you guys a little bit better than they did doing that kind of work. You know, so it just all depends on your military experience, what you go through. Some leadership, they might be doing that now with these newer, you know, iPad soldiers. You know what I'm saying? But I joined the army in 03. You know what I'm saying? It was get you trained, get you out the door, get you in the desert. You know, so it's just one of those. We gotta be, as Black men, we also gotta be mindful that the times we joined, it was a different time. Okay, it was definitely.
I came in '82.
Oh,
That's
damn.
why I cast
Sir,
here. So
82, my dad probably didn't have. That's a different conversation. I'm going to 84.
definitely. Yeah.
But you,
Go ahead. I'm sorry.
All right, guys, we're approaching the 1:45 hour. I'm okay with it if y'all are.
look,
Just want to let y'all know what time we're at, but we may have 2 more questions, maybe. I did have one, oh, let me check the chat too. Sorry,
there's nothing in there right now.
let me check the chat. It's not any, okay, no chat, okay.
I have more of a comment, you know.
Okay, comment,
Out
okay.
of everything that was going on and to answer your question.
And to answer your question, like I heard what I heard looming under from Mr. Ross is just that, you know, you want to keep things quiet because if you get into disclosing too much information, then can be held against you.
At that point in time.
That's what you're trying to.
Yes, ma'am, at that point in time, yes. Yes. You can't. We all family here, right? We all family here. We all family out there. You can't. You better not outshine the master. Keep it real. You better not outshine the master. All right.
I think it was supposed to outgo the man.
No, that military.
You got that thing on. Man back there said, it all depends on when you get it, sir.
Right.
Him and I entered in '82, so it's a whole different ballgame than versus the iPad.
Look, I joined in 03. I ain't like that now.
I just want to put
Well, this is, I mean, these are simple questions, I just have one. So when you look at, not just cancer, but, I mean, goodness, when you look at the steps for African Americans, for popular cancer, for heart health, for, I mean, all the things, breast cancer, you have the highest rate for a majority of the kind of conditions that are out there. Today, we're talking about prostate cancer. So when you look at prostate cancer and prostate cancer outcomes, you know they vary across, of course, racial and socioeconomic groups. So that's society and then the economy, finances, and all the things. What steps can we take to close those gaps?
Sure.
Communicate. Everyone in the room raising, everybody. If you are on a panel, put your hand down. You are part of healthy conversation. Okay, so the ones that need to be here are African American men in the community. Those are the ones that's not here because they need this education. Although we're getting it and we're going to pass it along and we invite them, But we need to do more with, if we say we're gonna advocate, we have to do a little better with actually, hey, come with me. Come, this is something that you need to be a part of. So we need to communicate and continue to advocate. I think the communication is the biggest barrier. Communicate, because I'm telling you, if I had cousins here, my father here, and to hear this young man's story, I think they'll take it more serious to hear it for themselves versus me going back to tell.
Right. So communication is one. When you look at socioeconomic though, that's society and how those societies function. So you may have one group who does well financially, and they have access to all the things.
Right.
Have other groups who not, and they have a plethora of barriers like transportation, they may not have a job, they may not have a job. Okay, when you don't have a job, then you can't afford the insurance to go to the doctor. Or the copay, so that's a legislature government type thing. So if the victor says he's doing his part and going to the capital.
And network, because there are resources. There's a great resource right here in network. So it still goes back to communication. We have to let the people know what's available. Because I think it's probably in yourself when you came up to my salon, how one of the customers, he said he didn't think he would be eligible to receive services here at the health department. What did you do? You communicated with him and gave him the information. So I still think it goes back to the, communicating. There's resources. There's third-party transportation where people will actually, they're paid to pick people up and take them to the doctor.
We don't do prostate screening, so we think you do have a provider office across the way in this building.
Yep.
And our Uber services may bring you here for that, so you're right. Need a question to a provider.
And I was gonna mention, we also do partner with a lot of large providers in the community. So every once in a while, they actually bring some of their screening vehicles on site. You'll see them parked in the parking lot, whether it's doing eye exams, whether it's doing women's care, men's care. So if you see it on site, take a picture, post it on your social. Hey man, you need a screening, come to the health department today. The bus is out there, and it's usually parked right here where the bus stop is, right on the, ain't but 100 feet away, if that. So definitely,
Yeah, you can do that, right? And again, you gonna remember me about what I keep saying. New Bern, North Carolina, Craven County, big. You can say all over they say you want from North Carolina. Yeah. I actually last year we did a free screening in North Carolina, New Bern. We did over 200 men in a 3-hour time. 200 men. UNC had never seen it. All right, 200 men in a 3-hour time. Also, I speak to over 100 churches a year. Prostate cancer, sharing information. And I think, and I was a city official for a long time in the city of New Bern, you see I love to talk, communicate, say the word communicate. But as you see, as the doctor said that African American Black men are more susceptible to get prostate cancer than any other race. I think it's this disparity of health inequality. And that's why I'm sticking close to legislation to let them know that we need to start bringing more health things to the community instead of them having to come here. Take it to them. Okay? Take it to them. The rural area, take it to them. All right, because they don't want to come, but it's a burden of transportation. So we need to get that funding. That's why I want Captain Hill to get that funding from the top. The last few years ago, the money was given, and we got $120 million. How much of that $120 million come down local?
We have one more question. We have one more question. Comment.
My question is the state. The other communication, I believe, eligible, but the means of we want here
dealing with young African Americans. We have to make some based on the time, distance between our ages. So, not to say anything about anybody on the panel, but you're not attracted. So I think it's-
I had,
How you gonna let information to the
that
generation?
was brought to my attention a long time ago, and I was running for office the first time. I was going in the neighborhood, and I'm from there, but they know me. But to relate to the younger generation, I needed somebody young. The white people that was on my campaign, they couldn't speak to us. Because we don't receive things from them. So what you're saying is true. We need to be the avenue, the transportation, we need to be able to talk that language. So they're not hearing from us, because we 60, I mean 60, y'all pretty sure we 60. So they're gonna see it, but they're not really gonna hear us. Young man back there, if they hear him talking, but they're gonna really listen more. So it depends on how you deliverance.
Right.
I don't. I use my son. I don't. I got a 14-year-old son. I also coach and direct, so I use them as my vehicle for a lot of things. Whenever y'all have events here, I'll have my son and his friends here volunteering their time. Cause hey, you need some extra credit, you know what I'm saying? Let's go. And that way you, hey, so I need you to go talk to this person over here, this young man over here. You know, you gotta use those vehicles. Cause I know I'm 40. And for me, most kids aren't gonna listen to me. But I know if I can reach somebody that will and use them as that vehicle, you know, and let's play musical chairs with it. If you know you're gonna reach somebody that's 35, reach that person that's 35. Hopefully that person will reach somebody at 30. And it'll just keep going down till you get to the age group you need it to get to. But use whatever avenue you have to create that space to conversation to even happen. You know what I'm saying? Y'all, look, we got a whole auditorium of people in here. You know what I'm saying?
Thank
Come,
you,
look,
Ms. Sheena.
come to the health department. Use the list.
Wisdom and your questions answered, and of course, if you have any other questions on that time card, the QR code, use it, send us the messages. All right, guys, thanks, guys. Our vendors are still here. If y'all have questions or wanna buy something,